starting to make ones that count. I have a counter one that I'll bring in. But this thing has a counter on it. See the counter? So you get 60 doses in here. You take it twice a day. It lasts you 1 month. And when you get to dose number 5, the number turns red. See my red 0? See the number turns red? It turns red at dose number 5 to remind the patient that you only have a couple days left. You need to get a refill on your prescription. You like that. It's a pharmacy, right? It tells them, go get a new prescription. This is really good. Okay, now the thing about this is you cannot see inside, but when you read your book, there's a long piece of tape, foil tape, and along the way there's little bubbles, blisters in it, right? And in that blister is the drug. And so when you open it, okay, and that advances it, and when you push this lever, so open up your device, hold it level, like this. Hold it level, push this device, and you'll hear a click. That punches a little hole in the blister so the drug powder can come out. Now I'm going to hold it level. If you tip it, the powder will fall out of it. So you have to exhale. Now if you blow into it, you'll blow all the medicine away. So you have to exhale, put it in your mouth, and suck in as fat like this. Do that. Okay, there's no drug in these. You won't be harmed. There's no drug. Those are placebos, and this one is empty, right? Okay, now why do I have to suck in fast? You have to suck the powder out of it. It's a human-powered device. You sucking the air through it grabs the powder and sucks it into your lungs. So if someone couldn't breathe in good, they might have trouble with this, right? They couldn't inhale good. Now I have another one here. This is the one my mom uses. Okay, and I want to show it to you. This is called a handy-haler. Oh, come on, handy-haler. Oh, no, that's supposed to be like that. Okay, inside this goes a capsule of powder. So dry powder inhaler, only Advair has they invented it, has that piece of tape with all the stuff, 50 doses. All the other ones, you have to put a capsule in it, okay? So I have one here, and it says on it, placebo, okay? So this is cool. You drop this in here. Oh, by the way, before I do that, see, watch what happens when I push this button. See the puncher come out? See that puncher? Put your finger in there. Do you want me to do piercings for you for free? When you push this thing, it's got 2 of them. There's one in the top and the bottom. It's gonna punch a hole in the capsule. See the little puncher thing? So you drop your capsule in like this. Now imagine having arthritis like my mom. And then you bring this thing down here. Now again, you click it. You're gonna punch it. So you're gonna get it like this and you punch it once. You don't want to shatter the capsule because you don't want to inhale the whatever, glycerin. Okay, then you blow out. Hear it vibrate? So that's feedback. Because when the patients take this one, they go, nothing happened. It didn't work. I don't think I got any medicine. If you take it again, you're overdosing yourself. So on this one, there's a little thing that vibrates that tells you that you're getting your medicine. You take this thing open again, you dump this out, and that is 24 hours. 1 dose, 24 hours of bronchodilation. Pretty cool, huh? My mom doesn't like the fact that there's no way to, it's hard to get this open. She wants a little knob on it because she has arthritis. So there's some issues with this one a little bit. And then I'm gonna show you the one I like. This one, same thing. This one is for another bronchodilator called Foradil. All these things have crazy names. This is the Advair Discus. This is the handy-haler. This is the Foradil Aerolyzer. So this is a very good drug. You drop the thing in there. Oh, sorry. It's got little puncher thingies, a whole bunch of them on this one. Stick your finger in there. Punchers, right? See the little puncher thingies? Spikes. Really a lot of spikes. Go ahead, stick your nose in there. Okay, so you drop this thing in here, and then you swing this thing shut, and sometimes I swung it the wrong way, and it goes shut, and then you're gonna punch it. Okay, and this one I'm gonna hold like this, right? And lots of feedback, so I know I got something. Now what else is in here besides drug is a little bit of lactose, which is milk sugar. This will not affect people that are lactose intolerant, but you may taste a sweet taste on your tongue. That would also tell them they got their medicine, or that they put it on their tongue. All of these DPIs, or dry powder inhalers, have the same thing in common. You have to activate it or pierce the thing in some way, and then you have to hold it level so you don't dump the powder out. And you can't blow into it, and you have to breathe in fast. Now, little old ladies like my mom, when they get sick, can't do that. So here's the alternate technique when they're little tiny kids or little old ladies. They can take several breaths off of it to get as much in, and it works. Not as good as if they can take a big, deep breath. This is not to be used on people. FDA won't let people younger than 4. When my daughter got it, she was 5. It was 5. You had to be 5 years old to take this. Wow. But Dr. Griffith let me give it to my daughter at age 4 because I knew what I was doing. And Jessica demonstrated to him that she could do it better than he could. So that was good, right? But generally, you got to be about 4 or 5 years old before you can use this. Now, for these puffers, we also have, for the puffers, things for kids. And it may surprise you, but they work as good as anything else. So when you put this on this is for a baby, this is for a little kid. So you put this on there, and what do? The mom or the therapist puffs it. The kid, like, what are you gonna do? Tell a baby, take a big deep breath and hold it. You didn't do that, huh? Whack, whack, whack. No, like this. Babies or child is gonna take 6 or 8 breaths to it. If you have a 3-year-old, so these really work. You don't need that SVN with all the mist and all that crap. You can puff the puff in there, put it on their face, and just have them breathe in and out for 6 or 8 breaths, and they get their medicine. It's faster, it's cheaper, and it's cleaner. There's no water to grow germs. There's no equipment to clean. You don't have to throw it away. And you can take it with you anywhere you go. Now, they make battery-powered nebulizers, but that's like a couple $100 and all that stuff. This is cheap. With insurance, most of these drugs cost the patient like $15. Yeah? So that's really good. Now, the only exception to that rule is Medicare pays for nebulizers for seniors. So it could be free for them. They give them the worst possible method that's the hardest one to keep clean for free because it's old and they approved it 30 years ago. So puffers aren't really on the Medicare list, but they're the best way to go because they're easy to take with you. I always have my medicine when I need it, right? And I can give it to babies, kids. Anybody can take this if they're breathing, but you have to use a mask if they can't follow directions. A lot of times at the hospital, if they can't follow directions, we go to the nebulizer, to the SVN. But even that stroke patient who needed a mask for the SVN, we could put a mask on this thing. They make adult ones with masks too. Okay? Now, the other thing we're going to do after lunch is we're going to practice drawing up stuff with syringes. But what I'd like you to do now is try the